Every 8 minutes, an older adult in America ends up in the emergency room because of a medication mistake. Most of them never saw it coming. They were simply taking their pills exactly as prescribed, one bottle at a time, with no idea that two seemingly harmless medications were fighting each other inside their body. If you or someone you love takes more than one prescription, this video could save a life. Why does this happen so often to seniors specifically? It's not carelessness. It's biology. As we age, our liver and kidneys process drugs more slowly. Our body composition shifts, changing how medications distribute and linger in our system. A dose that was perfectly safe at 50 can become risky at 75, even if nothing else about the prescription has changed. Stick with me, because by the end of this video, you'll know exactly what questions to ask your doctor, which combinations to watch for, and how to build a simple system that protects you for years to come. This isn't about fear. It's about control. Let's start with the first major danger zone: multiple doctors prescribing without knowing about each other. Many seniors see a cardiologist, an endocrinologist, and a general practitioner, sometimes within the same month. Each one might prescribe something new, unaware of what the others have already ordered. This is how dangerous overlaps slip through the cracks. The fix is surprisingly simple. Keep one master list of every medication you take, including dosage and the prescribing doctor's name. Bring it to every single appointment. Hand it over before the doctor even asks. This one habit closes the communication gap that causes so many preventable emergencies. Update that list the moment anything changes. Did a specialist adjust your blood pressure medication last week? Write it down immediately. Did you start a new supplement? Add it too. A list that's even slightly outdated can be almost as dangerous as having no list at all. Now let's move to the second major point: the pharmacy problem. Many people split their prescriptions between 2 or 3 different pharmacies, maybe one near home and one near a specialist's office. It feels convenient in the moment. But it also means no single pharmacist has the full picture of what you're taking. Here's why this matters so much. Pharmacists run interaction checks using specialized software every time they fill a prescription. If your medications are scattered across multiple pharmacies, none of them can catch a dangerous combination because they simply don't see the whole list. Consolidating everything into one pharmacy turns your pharmacist into an active safety partner, not just someone handing you a bag. Most pharmacies today also offer free medication reviews. Ask for one. A trained pharmacist can flag risky combinations that even a busy doctor might miss during a rushed 15-minute appointment. Third, let's talk about something people rarely think about: over-the-counter drugs and supplements. You might assume that because something doesn't need a prescription, it must be safe to combine with anything. That assumption has landed thousands of seniors in the hospital. Common painkillers like ibuprofen can seriously interact with blood pressure medications and blood thinners. Even something as ordinary as aspirin, taken alongside prescription blood thinners, can increase bleeding risk dramatically. Herbal supplements are no exception either. Street John's wort, often used for mood support, can weaken the effectiveness of heart medications and antidepressants. Always tell your doctor and pharmacist about every supplement, vitamin, and over-the-counter product you use. Bring the bottles if you have to. What feels like a harmless daily habit could be quietly undermining your prescribed treatment. Fourth on our list: food and drink interactions that catch people off guard. Grapefruit is the most famous example, and for good reason. It can dramatically increase the concentration of certain cholesterol and blood pressure medications in your bloodstream, sometimes to dangerous levels. But grapefruit isn't the only culprit. Dairy products can interfere with certain antibiotics, reducing their effectiveness at exactly the moment you need them most. Alcohol, even in small amounts, can amplify the sedative effects of many common medications, increasing fall risk significantly. Ask your pharmacist directly, are there any foods or drinks I need to avoid with this new prescription? It takes 30 seconds and could prevent a serious problem down the road. Fifth, let's discuss timing and organization, because even the right medications taken at the wrong time can cause issues. Pill organizers sound simple, almost too simple to matter. But they solve one of the most common problems in medication safety: confusion about what was already taken. A weekly pill organizer with labeled compartments for morning, afternoon, and evening doses removes the guesswork entirely. You glance at today's slot, and you know instantly whether you've already taken your medication. This single tool prevents both dangerous double dosing and equally dangerous missed doses. For those managing 5 or more medications, consider automated pill dispensers that lock compartments until the scheduled time and send reminders to your phone. These aren't just for tech enthusiasts. They're becoming essential tools for safe, independent living. Sixth, we need to talk about recognizing warning signs of a bad interaction before it becomes an emergency. Dizziness, unusual fatigue, confusion, or a sudden change in appetite can all signal that something is wrong. Too often, these symptoms get dismissed as just getting older. That assumption can be dangerous. A new symptom that appears within days of starting or changing a medication deserves attention, not dismissal. Write down when the symptom started and what changed around that time. This timeline becomes incredibly valuable information for your doctor. Don't wait for your next scheduled appointment if something feels seriously wrong. Call your pharmacist or doctor's office directly. Most pharmacists will happily answer quick safety questions over the phone, often without an appointment at all. Seventh, let's cover the annual medication review, something every senior should schedule like clockwork. As health conditions evolve, some medications that were once necessary may no longer serve a purpose. Others may need dosage adjustments based on changes in kidney or liver function. This process even has a name in the medical world: deprescribing. It's the deliberate, careful reduction of unnecessary medications under medical supervision. Studies show that many seniors take at least one medication that could safely be reduced or eliminated entirely, yet this conversation rarely happens unless the patient brings it up first. Schedule this review annually, even if you feel completely fine. Bring your master medication list, ask specifically about anything you've been taking for more than a year, and don't be afraid to ask, do I still need this? Finally, let's address storage and disposal, an often overlooked piece of the safety puzzle. Medications stored in humid bathrooms can degrade faster than expected, sometimes becoming less effective without any visible sign of change. Keep medications in a cool, dry place instead, away from direct sunlight and moisture. When a medication is expired or no longer needed, don't just toss it in the trash or flush it down the toilet. Many pharmacies now offer free medication take-back programs designed specifically for safe disposal. This prevents accidental ingestion and keeps expired medications out of water systems. So let's bring this all together. Keep one updated master list. Use a single pharmacy for everything. Disclose every supplement and over-the-counter product. Watch for food and drink interactions. Use pill organizers to eliminate confusion. Pay attention to new symptoms instead of dismissing them. Schedule annual medication reviews, and dispose of old medications properly. None of these steps require special training or expensive tools. They require consistency and a willingness to ask questions, even when it feels inconvenient. Your doctor and pharmacist would much rather answer a simple question today than treat a preventable emergency next week. Medication safety isn't about distrust of the healthcare system. It's about becoming an active participant in your own care. You know your body better than anyone else does, and that knowledge, paired with the right systems, is the most powerful protection you have. Start with just one change from this list today, and build from there.